The human blood sugar level is tightly regulated. After a meal, the level of glucose in the blood rises. In a healthy metabolism, the body deals with this quickly by secreting a proportionate amount of insulin. But millions of people are affected by type 2 diabetes, a complex metabolic disease causing hyperglycemia, permanently increased blood glucose levels with post-meal peaks. Glucobay, with its active agent acarbose, is recommended for the treatment of hyperglycemia. It targets exactly the dangerous postprandial glucose peaks. Glucobay is taken orally, and acarbose then affects the uptake of glucose from the small intestine. Physiologically, the complex carbohydrates in the lumen of the small intestine have to be broken up by the enzyme alpha-glucosidase before the resulting glucose molecules can be taken up and finally reach the bloodstream. After administration of glucobay, acarbose competes with the complex carbohydrates for binding to alpha-glucosidase. As a result, many complex carbohydrates remain intact and the uptake of glucose is reduced. In this way, alpha-glucosidase inhibitors, such as acarbose, delay the absorption of carbohydrates from the gastrointestinal tract and effectively reduce postprandial plasma glucose excursions. Glucobay delays the progression of diabetes and provides additional cardiovascular benefits. In diabetes, the dangerous postprandial glucose peaks may damage the blood vessels. Prolonged exposure to hyperglycemia leads to a thickening of the blood vessel walls. A wide variety of studies suggest that the reduction of post-meal hyperglycemia achieved by glucobay reduces the risk of atherosclerosis and other detrimental vascular effects. Diabetes is also often associated with increased blood pressure. Atherosclerosis and high blood pressure are powerful risk factors for cardiovascular consequences, such as coronary artery disease and myocardial infarction. By reducing hypertension and other detrimental vascular effects, glucobay may decrease the risk of acute myocardial infarction and can help prevent pathological cardiovascular changes in type 2 diabetes patients. Therefore, glucobay treatment provides added confidence in the management of patients with known cardiovascular risks. The unique mode of action of acarbose shifts glucose absorption from the upper to the lower small intestine. As a mild temporary side effect, flatulence might be caused. This undesired effect occurs most often when treatment is started with a full dose. It can be controlled by employing a start low, go slow dosing regimen. Initiating therapy with a reduced dose once daily and then gradually increasing to the full dose may minimize possible gastrointestinal side effects. Furthermore, as the bioavailability of acarbose is only 1 to 2%, the risk of systemic side effects and that of interactions with other drugs are minimized. Glucobay has an exceptional safety profile, which avoids hypoglycemia and weight gain. Glucobay, with its unique, non-systemic mode of action, prevents post-meal hyperglycemic peaks and provides benefits reducing the risk of cardiovascular events. It has an excellent safety profile and can be given alone or in combination therapy. Glucobay provides long-term glycemic control.